Hi, I'm Selina with What's Up Oxford, and I'm joined today by two very special guests, both from Woodstock General Hospital. I've got Perry Lang, the CEO, and I've got Jayne Menard. And Jayne, you've got a pretty long title. I'm going to let you introduce that.
Okay, I'm the Vice President of Patient Care and the Chief Nursing Officer here at Woodstock Hospital.
Awesome. So we're going to talk a little bit about COVID. Obviously, we're right in the middle of that, but let's talk about the actual procedures. So I know that we've got the testing center, the trailer, as some people are referring to it, outside of Emerge right now. Let's talk a little bit about how that works and what the purpose of that is.
So back in early March, in conjunction with some discussions with Public Health, Southwest Public Health, it was recommended that the hospital stop performing all non-essential services. So that is elective surgery and many other procedures done within the hospital that are not essential. So with that ramp down, that gave us the ability to decrease our inpatient bed capacity in anticipation of any COVID volume surges. With that, we also restricted our visitors to the hospital in an attempt to stop the spread of COVID if there was COVID spread in the community. And also, we put a trailer on site to service any patients with COVID-type symptoms and keep them out of our Emerge waiting area so there wasn't any contamination of other Emerge visitors for various other reasons. So the COVID Assessment Center is through a screening process, and you can call the number 1-855-905-6148, start the screening process. Trailer is open by appointment only from 10 a.m. to 8 p.m. And we're seeing anywhere from 20 to 45 visitors to the trailer any given day. And that's really to be assessed and, if necessary, swabbed for COVID-19.
Okay, so Jayne, how has that affected the numbers that you're seeing in the hospital, maybe through Emerge, that kind of thing?
So as Perry mentioned, we did ramp down a lot of our non-elective procedures and surgeries and that type of thing. So overall, our volumes have been down. And the other piece is that our emergency department visits have been down. I think the message has been sort of to stay at home unless you absolutely need to be in the hospital. We do want to make sure that people are aware that if they are having problems or pains or anything that was unusual and they can't get in to see their family doctor, that the emergency department is still here to serve them, and we are open. And if people are afraid to come to the hospital because they're afraid that they're going to get COVID, we just want people to know that we've got the department set up so that we have a hot zone and a cold zone, so that, you know, the COVID, anybody who comes in with suspect COVID, you're screened immediately at the door. Those people are sent to a separate area, and the general non-sort of suspect COVID patients are in another area. So, you know, that has been set up by our emergency department manager, physicians, etc., and that is working very, very well. So, you know, we are still here, as we said, to do emergency department visits.
Okay, so what has been the feeling among the team there at Woodstock Hospital? Are people, I know that my sister actually works in Emerge, so she has mentioned that it has been quite quiet, but how's the morale of everybody that's working there right now?
Well, I'm going to say that I think that initially people were very anxious and nervous when this started. It started very quickly, and it took us a while, as every organization, to get things in place, get processes in place, make sure that we had the adequate equipment and supplies. Everybody knew what their job was, training, education. I feel that people are, you know, a lot more confident and not feeling nearly as anxious as they were before. I think that we were lucky that there wasn't a lot of activity at first, because that actually allowed us time to make sure that people were properly trained and we had everything necessary. We thought about all different scenarios so people are prepared. We are actually seeing a little bit of an increase in our volumes, but certainly not back to the pre-COVID volumes that we saw before this all started.
Things we've done within the facility is we really increased our negative pressure room capacity. We've added 9 permanent negative pressure rooms, and that is really helpful. Should we have some COVID inpatients, we're able to treat them in a negative pressure environment.
Now, I know that the numbers in this area have been considered fairly low. Do you think that's because in this community, people really jumped on the restrictions, or is that just due to the nature of being separated from the big city?
So I don't know. I think that actually is a combination of both. I think that people in Oxford County have been very careful. You know, I noticed I live in a different community, and like very shortly when this happened, I know grocery stores were all closing at 8 o'clock, and I had to rush to get some groceries before I went home. And I went to, I think it was Zares, like a 20 to 8, and they had already set up their marks on the floor and had, you know, all of these different things in place. And then went to my home community a week later, and they were just getting those things in place. So I think that the community has really responded well and very timely. I also think that we are a smaller community, so we don't have as many people, and it is easier to you know, really promote and stay true to social distancing.
So Perry, I'll ask you, at the start, I know that there was some difficulty sourcing PPE, there was shortages of certain things. Are we still finding that that's the case at this point?
We're very fortunate. A month ago, our PPE supply was probably 3 or 4 days for most items, especially isolation gowns and masks. We're very fortunate, and we were able to, through a group purchaser that hospitals use, we now have PPE supplies of about 3 or 4 weeks. So we're able to extend our inventory, and also luckily, because we've had very limited COVID inpatient cases, we haven't used as much PPE equipment as other larger hospitals have. The community was excellent in donating PPE. We probably received PPE from 40 different individuals or companies. So we're very fortunate to live in the community we do, where they reached out and gave us some PPE that we're able to use. But fortunately, we're now out with probably about a month's supply.
Okay. Now, is there anything that the community can do at this point in time to help support the hospital?
Well, I think at this point, it's listen to what's the messages of Southwest Public Health. That's the physical distancing, staying at home, and just ensuring that we try not to spread COVID unnecessarily throughout the community. And we've been in good partnership with Southwest Public Health, and they've been on top of things and very proactive in their approach to working with COVID.
Okay. Jayne, if someone does suspect that they may have some COVID-like symptoms, what is the first step that they should do?
Well, first of the thing they should do is isolate themselves, call their family doctor, see if they can get in for an appointment. If not, they can call the one that number that Perry mentioned at the beginning of the call and get an appointment through there, or they could come to the emergency department. So there's sort of 3 avenues to get help, but they should be, you know, if they're feeling those symptoms, they should be screened.
Awesome, thank you. So I think the biggest thing I'm going to speak for the community is just thanking you guys so much. Our frontline workers have done so much. You've kept us safe, you've kept everything up and running, and thank you so much for that. And definitely pass that on to the entire team there at the hospital. Thank you.